Welcome back. Every parent knows every child is different. Getting potty trained is easier for some kids than for others, but usually happens by 4 years old. For some children, though, wetting the bed remains a problem. However, Dr. Patrick Lehman is a pediatrician with Children's Wisconsin, and he's here to talk through that a little bit with us. Dr. Lehman, good to see you again.
Thanks for having me, Vince.
Okay, so we say up to about 4 years old. That's pretty standard for kids. Some kids take a little bit longer in potty training. What's the difference between not quite being there yet and then like a bedwetting issue, what we're talking about today?
Correct. So I have a daughter who's 4 years old, and she potty trained about a year ago at 3 years old, but she's still in pull-ups overnight. And a lot of children will still be in pull-ups or having bedwetting until at least 5 years old. But even then, actually, there's about 5 to 6 million children in the United States over 5 years old that are still wetting the bed at night. And for comparison, that's the whole population of the state of Wisconsin. So a lot of children still have this difficulty.
So when we talk about that, what are some of the causes behind it? Are some kids just going to get there eventually, and then some kids actually have maybe a disorder or something we need to be more concerned about?
That's the thing I stress most to parents, is that this is something that a lot of times just takes time, right? You know, and so that's something that parents maybe get a little bit frustrated about. You know, like I want to be able to help my child, but sometimes they just need to develop on their own terms, right? You know, and so sometimes it'll take a couple of years. Sometimes kids even 10 or 11 years old will still have bedwetting difficulties. So don't stress out about it. Really, that's the thing I talk to the parents most about.
If we're talking about those kids who actually have a legit difficulty or some sort of condition or thing that needs to be overcome, what are some of the causes behind that?
So one of the things I recommend for parents is that if their child has been dry at night for 6 months and then they start wetting the bed again, that's kind of a warning sign. I say maybe go talk to your pediatrician about that. But some of the causes that can cause bedwetting are constipation is one of the causes. Sometimes a urinary tract infection if your child has difficulty with or pain with peeing. That's something you need to keep your eye on as well too. And sometimes actually being a deep sleeper. So sometimes somebody that has the inability to be able to wake themselves up at night will also wet the bed as well too.
Outside of the serious problems, which might require some expert help, what are some tips or things that parents can do as a practical way to try and help a child through that?
So some of the things you can do right away are pretty simple. One is limiting the amount of fluid you take right before bedtime. Also being able to let your kids pee right before bedtime and then maybe even 10 minutes after that, so about twice before they go to bed, to really fully empty the bladder. And then if you guys do things like soda or juice, it's okay for birthday parties and that kind of thing, but maybe kind of cut that out because caffeine can actually cause kids to wet the bed overnight as well too.
Oh, a double threat there, right?
Yeah, definitely.
Don't want the soda anyway, right?
Yeah, sometimes every once in a while.
Here and there.
Right? Yeah,
okay, we'll take it. Doctor, thanks for that advice. Appreciate it very much. And if you'd like more information on this topic or any of the things that we regularly discuss with Children's Wisconsin, you can head to our website, tmj4.com/links.